Yeah, well, three things that I like to talk with my male patients about are really basic things. Good health tips for everyone, and that's getting enough sleep, incredibly important for our physical, mental, cognitive health. And we actually shortchange that a lot of the time. There's sort of an epidemic of not quite getting enough sleep in our society. Two is staying active and just getting some amount of physical activity in as much as you can fit in during the week. I know it's hard. We're all scrunched for time. But the great news is that even a little bit is incredibly helpful. So if you're not active, walking for 5-10 minutes a day is a huge improvement for you right there. And just kind of keeping working on that. The goal would be about 30 minutes, 5 or 6 times a week, if you can fit that in. And then lastly is just a healthy diet. And again, that's another good part about healthy diet is that it doesn't have to be perfect all the time. If you're making healthy choices, just more frequently making sure at least one meal of your day has some fruits and vegetables. Every small sort of improvement really adds up over time. So the main symptom that people will probably have heard of is chest pain or chest pressure. It's often in the center or the left side of the chest, but not always. And it usually lasts for more than a few minutes for real heart attacks. And people might notice some other symptoms. Sometimes the pain goes into the left shoulder or up into the left jaw. Sometimes it can be more in the back potentially. And then people might just feel off or weird. They might feel a little lightheaded or dizzy. They might feel sweaty, nauseous. Those are all some of the symptoms that people can have. So if you're noticing those symptoms and they're not going away over a few minutes, that would be something to want to get checked out.